Okay, so we're gonna administer oral medications first. So the first step we're going to do is make sure that we are checking our orders against our MAR. So I'm going to be checking to make sure that I have the correct patient with the name and date of birth. Then I'm going down to the medication. So this is my orders, this is my MAR. So I want to make sure that I have Robitussin 250 milligram liquid every 4 hours per mouth for 3 days. So I have it here, Robitussin 250 milligram liquid, Q4 hours, PO for 3 days. Then I have Digoxin 0.5 milligram tablet, PO once a day at 8 a.m. And then I have Lasix 80 milligram tablet, PO once a day at 8 a.m. holding for systolic blood pressure less than 90 or diastolic blood pressure less than 60. So because all of these match correctly, I'm going to put my orders away and just work off of my MAR. So I'm going to perform hand hygiene. I'm going to collect my supplies. So I have my cups here. So then I'm going to start getting my medications. So I will look for and get my Robitussin. So I'm double checking the Robitussin label with what's on the MAR. So Robitussin 250 milligram liquid every 4 hours. So this is Robitussin 500 milligram in 5 milliliters. I'm also checking the expiration date. So for this, I will need to do some med math. So I know that I am giving 2.5 milliliters for this. So I'm going to cover the label. I'm going to double check where my 2.5. I'm going to get down at eye level and slowly pour. Okay. So that's right at 2.5 milliliters. During your checkoff, you will have your instructor double check that amount. So I'm going to make sure that's closed and put that away. Okay. Okay. The next thing I'm going to get is the Digoxin 0.25 milligram tablet. So I'm going to go through my cart and look for that. So then, so I have it here, so I'm going to double check the medication with the MAR. So this is my second check. So Digoxin 0.25 milligram tablet. So that's correct, and I'm going to be double checking the expiration date. Okay, so I'm going to set that there. Next, I'm going to be administering the Lasix 80 milligram tablet. So with this, I have 20 milligram tablets of Lasix. So again, I am required to do med math with this. So for this patient, I will have to give them 4 20 milligram tablets. Okay. So I have those there. Okay, I'm going to lock my cart, take my MAR and my medications, making sure I have water, to my patient's room. I'm going to knock. Hi, my name is Ashley. I'm your nurse for today. Can you tell me your name and date of birth? So the patient has told me their name and date of birth is Tammy Turner, 9/22/58. Okay, well, I have some medications for you today. I'm going to perform hand hygiene, provide privacy. So Ms. Turner, I have for you some Robitussin. So that is for your cough. I heard you had a pretty nasty cough, so that will help help with that. I also have Digoxin, that is 0.25 milligram tablet. This is to help with your heart. And then I have Lasix. This is a diuretic. It will cause you to pee a lot, okay? But first, I need to do some assessments. So I am going to, I have my stethoscope. I'm going to listen, obtain an apical pulse for a full 60 seconds. While I'm here, I'm also auscultating the lungs because the patient has a cough. And then I'm checking the blood pressure as well for the Lasix, since I have to, it's to hold it if it's less than 90 over 60. So all the vital signs are within normal limits. It's all okay for me to get the medications. I'm also going to assess the patient's swallowing. So I'm going to ask if they can swallow, if there's any issues with that. So the patient tells me there's not. I'm going to go ahead and set the patient up into a high Fowler's position. Okay, so the very last and third check that I'm going to complete is checking the medications one last time against the MAR with the patient. So first I'm going to check the Robitussin, again down at eye level. So it's 2.5 milliliters, so 250 milligrams. So if the patient is able to take the medication, I'm going to hand it to him or her and allow them to take it. But because he can't, we're going to pretend. I'm going to help him out. I'm going to follow that up with some water. Next, I have the digoxin 0.25 milligram tablet. So I have that here. I'm checking one last time. I'm going to give it to him with some water. So again, I'm assisting him take the pill with some water. And then last, I have the Lasix. So he has 80 milligrams total. So I'm double checking all that. Okay. Again, helping him one more time. Okay. Making sure, I'm asking the patient that he was able to swallow all of that okay. He says yes. All right, do you need anything else at the moment? So he says no. I make sure that the call light is within reach. Place him in a comfortable position. Okay, I'm going to remove my gloves. Perform hand hygiene. And then go back to my med cart. So I have all of my supplies with me. So once over here at the med cart, I'm going to document that I gave the medication. I'm giving it a little bit late, so you're going to document the time. And initial next to the time. And then complete your documentation. And then you will go back in about 30 minutes to an hour to follow up with any assessments for the patient of taking their medications.